Hello, everybody. Welcome to the PermanenteDocs Chat. I'm your host, Alex McDonald. I practice family and sports medicine here in Fontana, California, as part of the Southern California Permanente Medical Group. Thank you all for joining, tuning in today, listening from wherever you may be watching, listening. I'm really excited to welcome our guest today, Dr. Dhingra. He is an emergency physician and physician in charge of the San Leandro Medical Center at the Permanente Medical Group. And we are here to talk about, we're on the eve of National Doctors Day if you're watching this live, or if you're listening to this pre-recorded, March 30th is Doctors Day. And we are here to talk about what it's like being a doctor in today's environment. Obviously, there's lots going on and lots has changed. So we are excited to welcome our guest and just have a conversation about what it's like. If you have questions, if you're watching this live, please feel free to drop them in the Q&A. We'll get to as many as we can. And we're just going to jump right in and keep this high yield. So, Dr. Dhingra, thank you so much for joining us. Tell us who you are and what you do.
Great. Well, first off, thanks, Alex, for having me here. And as I was saying earlier, it's really a privilege to be here and speak on behalf of what it's like to be a doctor. But also, I'm part of an incredible group of physicians. So my background, I'm an emergency physician, and I'm the physician in chief for the San Leandro Medical Center, which includes wonderful physicians across our Hayward, city of Hayward, city of Union City, as well as the city of Fremont. And I partner with a physician named Dr. Eric Kane. And we get to work with our colleagues and really unleash their practice so that we improve community health. So a little bit about me. And personally, I've got 3 kids, 9, 11, and 13, and it's a crazy household. But I feel very privileged to be able to serve in a role as a parent, but most importantly also as a father as well.
Yeah, that's great. I'm right behind you. I have a 6, 10, and 12-year-old, so I can see into my future when we chat. No, I'm just teasing. Well, tell us, I guess, give us some thoughts and reflections on what it means to practice medicine and to be a physician in today's day and age, especially, coming off this 3-year pandemic. A lot has changed in the last 3 years. And I think some of this was probably in progress before the pandemic, and then the pandemic sort of accelerated a lot of these sort of, changes in terms of what it is to practice medicine, what it means to be a physician, both in terms of how we perceive our own role, but also how the public perceives our role too. So share some of your thoughts and ideas about just what it's like to be a physician in this day and age.
Yeah, absolutely. And first, I just want to wish, our participants and our colleagues that see this later a happy Doctors Day. I sort of think we should also have a happy Doctors Week. I know we celebrate an entire week locally, maybe even a month for those that are thinking about that, because to be a physician in the modern times, it's still a tremendous privilege. But to your point, a lot has changed these last 3 years. So a lot of it was in flight. I remember speaking to a group of colleagues, and we talked about video visits, delivering care virtually, and saying, wow, wouldn't it be great if we could get to 10% of our total visits that could be delivered via video? And you and I are obviously talking here via video. And it seemed like a very audacious, aspirational goal. And it was in line with where patients had expectations. We moved through the pandemic and suddenly, we're doing 50, 75, depending on where you practice, almost 100% of virtual visits. Mm-hmm. And while that was great as an accelerant to technology, it also taught us a lot about how important it is to be in person with our patients and have that interaction to keep them healthy. So a lot has changed in that respect. I think that when I went to med school, I remember a professor telling me that, look, you are going to be taking a social compact with your patients. That means that it's not only the care that you provide, but things that happen in the community, things that happen in their life are going to be into your practice and how you deliver care. And I believe that for our physicians, nothing could be further from that truth. That we have come in and we are now encountering issues around social justice, maybe the volatility in the economy. All of that comes into our practice. And is really affecting how we care for our patients. So it's really changed in terms of our understanding of what we do is much more deeply than the care that we deliver in the office. It's really about the work that we do also to make sure that they're safe in the community as well. So I think a lot of that has changed. I would be remiss if I didn't acknowledge that, regardless of what specialty you've been in, you've been affected both personally and professionally by this pandemic. And there are individuals that are maybe still emerging from these last 3 years, and there's some who are just ready to go and say, I'm looking forward to a different future. but we've all experienced, and some specialties have even had collective trauma, related to, taking care of patients that are undifferentiated, emergency physicians, ICU physicians, pediatricians, AFM physicians like you, ICU physicians. And, I think it's important that we understand that we still have work to do to support practice more, given the collective trauma we faced these last couple of years. So emerging out of this, though, I think it's a very exciting time because practice is changing, expectations are changing. This gives Permanente Medicine a fantastic opportunity to reinvent ourselves and continue to be the best place to practice.
Yeah, no, I could not agree more with you. And there's just so much to unpack with what you just said there too. And I think that the specifically the piece about social determinants of health, adverse childhood experiences are really finally beginning to gain traction. What I often will tell medical students and residents who work with me is my biggest frustration when patients come into my office is not their UTI, is not their chronic pain. It's all those other things which I feel like I have no control over. And I think that's why it's so important that as physicians and as our medical group, we really reach outside the four walls of our clinic, of our hospital, and really try to help impact the community where people live, work, grow, play. That's ultimately where health begins. And by the time they're seeing us, and especially by the time they're in the hospital, it's almost too late. And if we really want to think about improving the health of our community, we need to sort of expand the definition or the version of what it means to be a physician as well, too, and not just sort of, the biochemistry and the basic sciences. And that's obviously very important. But there's so much more to being a physician in today's day and age as well, too. So I would definitely want to give a plug for that sentiment as well. I think the piece about virtual visits, and there's just so many ways, and just in my own practice in the last three years, traditionally before I'd see patients, in the exam room every day, and now I'm answering a whole slew of emails and providing virtual care through emails. We have virtual visits and e-visits where patients can just sort of, go through an algorithm to kind of see, okay, do I need to seek care? Do I need to kind of do supportive things at home? Am I seeing patients individually? Am I doing video visits? There's so many different ways to practice medicine in this day and age too. And I think that's a good and a bad thing because we can kind of reach everyone where they are. But also at the same time, it can be a little bit overwhelming for us too. And that where we find that balance, I think we're sort of still figuring that out. And I've heard the phase, we're in our sort of our virtual delivery adolescence, right? We've been doing virtual care for a little bit, but we're now kind of in that awkward, weird period where we're kind of figuring out where that balance needs to be, so we can meet our patients' needs, but also making sure everyone has access to the benefits of virtual care and video visits, and not just those who have high-speed internet and things like that as well too. But I could go on and on, but I think that's really, really important to think about.
And I love what you said about virtual care adolescents, because I believe we are still figuring it out. And, outside of our system, right, there are policy pressures, there's payer pressures that come in that don't, pay for care delivery, but we are liberated from that model. We could do what we feel is best for our patients. And actually, to your point, we can unleash equity through this, mm-hmm. right? Because, not everyone has access to what we think they may have, but we have the offerings now to offer to everyone. And that's sort of like, at what point will we mature to that virtual care delivery system?
Yeah. And I think that's, I'm going to put on my government relations hat. I do a lot of government relations work, both within and external to KP as well. And I think that's a really important piece to make sure that our voices are present in Sacramento, in Washington, D.C., wherever those policies are being made, to make sure that we are really advocating for systems and policies which enable that as well too. That's a whole other conversation. We've tried not to go down that rabbit hole too. But that actually that does segue a little bit into your current role now versus what you imagine your role would be when you were in medical school or graduated medical school, and how is it different to be a physician today versus kind of what it was then, or kind of what you imagine it would be when you were finishing your training?
Yeah, it's a great question, and I did not anticipate that I'd be doing what I do now. And I still have a practice, mind you. It's a much smaller practice than what my colleagues do every day, seeing patients. But what I imagined coming out of medical school was that, I'd be seeing patients, right? And having those relationships. And, I was really attracted to emergency medicine, just the depth and the breadth of seeing all sorts of patients at different times, best and worst times of their lives, and caring for them. So that's what I imagine my practice being like, putting on the scrubs, wearing the white coat, taking care of patients. And what I learned, and I really think this was related to the mentorship that I had, not only in residency but medical school and really within TPMG, is that we have so many physicians, like you mentioned, the work that you do, that are doing something that's beyond their practice, and it's helping the greater good. Maybe they don't have a formal title, but you are doing something to influence even the neighbors in your community, or maybe the school board that you work with. And our influence is so much greater than I ever could have imagined when I was a lifting medical student.
Mhm.
And so what I really enjoy about what I do now is I have the ability to work with physicians and hear their ideas. I look at it sort of as our physicians are our compass. They tell you exactly what direction we need to head, and it's our roles to work together to say, how do we do that? How do we make it happen? So it's very different than what I imagined. But frankly, even though the last 3 years has been challenging, it's been at times exhausting. I have never felt more energized in my career than I feel right now.
Mm.
Because though there are challenges, again, I feel like as collective 8 medical groups, we have a great opportunity to really unite and lift Permanente medicine. Folks think this model can't be replicated. I don't think we should be worried about competition. What we should be thinking about is showing our policy and healthcare leaders how Permanente medicine creates better outcomes. So that's what kind of gets me excited, and that's what's totally different than when I started.
Yep, absolutely. I think that's so true. I think one thing we've sort of encountered recently here is this sort of the loss of expertise, and whether it be scientists or educators or policymakers or you name it. And I think physicians are unfortunately in that group a little bit. I mean, obviously, based on polling data, physicians are still very well trusted and respected members of the community. But I think we have sort of felt a little bit this pull of kind of not being trusted as experts in our field as well too. Have you experienced any of that? And kind of when you feel that, how do you respond? Or when you talk to other physicians who feel that way, how do you respond?
Yeah, well, I think trust is certainly a major issue. And I think as you kind of unpack it into different groups, whether it's different socioeconomic groups or ethnic groups, cultural groups,
Mhm.
there's different ways on how our patients view trust through the lens of healthcare. And I think one thing is I think a lot about the fact that was just tremendous misinformation these last few years. We all know, right, that different methods and treatments were espoused to, for example, treat COVID, and none of those things were evidence based. And what we did as a group, and what I believe our physicians do every day, is they say this is what evidence tells us, and these are the recommendations, and they have that personal relationship built in to be able to really help our patients through. Even if you are working in a practice where you don't have a longitudinal relationship, there is a trust factor built in
Mhm.
based off the fact that we are an integrated system and we're known as Kaiser Permanente.
Yeah.
What I've seen really skilled physicians continue to do is present the information, and they listen and they empathize. And I think that it's easy to it's been probably difficult when you see a patient, for example, who has a very preventable disease, or maybe could have had COVID prevented, a serious COVID presented due to a vaccine, but they didn't get their vaccines. I can see why one would get angry, but it's also to empathize, why they are where they are. Maybe some of it's from their background, maybe it's from something that they heard.
Mhm.
So a lot of it has created a lot of stress and strain on our system, a lot of moral injury. I think we can take a step back and see that we are still trusted in healthcare, and our reputation still is very strong in the community. And I think we have to really build on that because of what you said, how healthcare has lost trust over the last couple of years.
Yeah, absolutely. And I think there's been individual people that have done that, and there's been sort of institutional historic factors which have degraded that trust as well too. So I think you're absolutely right, is rebuilding that trust sort of one at a time, and really listening and helping understand where patients are coming from is such an important piece of that puzzle too. So we do have a question in the chat here, which is a little bit, kind of a bit of a segue into to that question as well too. So physician burnout is obviously a major issue in healthcare today. And how do you see healthcare systems addressing it, and how do you personally find joy and meaning in medicine as well? You touched on a little bit as well, but how do you do that, and then how do we think about that from a system point of view to keep our physicians mentally and physically healthy, and bringing their best selves to work every day so they can best care for the patients as well.
Yeah. This is I hope we continue to come back to this more and more, because I think this is going to be the work of healthcare for the next several years. This is another area where burnout accelerated, right? These last few years through the pandemic,
Yep.
to a point where I think if you were a physician, if you were a healthcare worker, you've experienced this at some point in your life. I know I personally have as well. So a lot of what I think about is, one is we shouldn't be afraid to address it. We shouldn't be afraid to talk about it in forums with our physicians. We should be listening for ideas. But I also think it goes beyond what medical groups do. So there's an aspect there which I'll touch on. But I also think that, Dr. Vivek Murthy recently put out his advisory on healthcare worker burnout, and really calling attention to say this will be a public health crisis if we don't address this. And there are recommendations. I think that we need to take that seriously. We meaning largely healthcare, multiple systems need to really embrace it and not look for just a singular way to address this as a system. But what are the things from a policy perspective that support physicians and really all healthcare workers to have a more balanced life, right? It's not about my career, it's also about a life.
Right.
So I think there's something that's much more macro. As a system, I think of a couple of things. One, I think about the culture. I think about the community, and I think about practice. And so I'll start with practice support. It has become more challenging to be a physician in the US these last few years. So we need to be just relentless to make sure that our physicians are doing physician work. And that means that, we often hear about top of license, right? Well, what does that really mean? It means that, you mentioned secure messages. If there are messages that you should not be answering because it's not going to really improve the patient and help your practice, we have to figure out through technology, through other systems, to address that. And you can see this in every single specialty, 24/7 specialty, surgical, et cetera. So we as a system need to relentlessly attack that, because when we do, we give our physicians time. When they have time, they provide better care, and then the whole ecosystem gets better. And then I think at the granular level at the medical center, it's about connections. If we spent 3 years doing this, right, and not seeing each other and connecting like this in person, we've missed out. And we need to get back to that. We need to get back to that collegiality that attracted us to our medical group, and really exemplify that as much as we can.
Yeah. And for those of you listening to this podcast, Dr. Dhingra just put a mask over his face to show that we have been isolated physically, emotionally, geographically, you name it. It's been a huge. I didn't realize how important that sense of collegiality, seeing your colleagues in the hallway and giving them a smile and asking them how they're doing. Those little kind of micro interactions, I think, are so important to maintaining our sense of purpose and our community as physicians as well, too. And we've lost so much of that in the last 3 years, and we're getting it back. We're getting it back, but I think we need to be intentional about that as well, too. We had a colleague who started here in my office. Gosh, I think mid 2020, like literally in the middle of the pandemic. I don't think I ever saw that person for like 2 years, and her office was 2 doors down from mine. And I think that's a huge recipe for disaster, quite frankly, as well, too. So I completely agree with you, and I'm glad as an organization, as a community, we're doing that as well, too. Tell me about what would you tell young people who are considering a career in medicine today? I think a lot of people have said, not a lot, some people have said that if they wouldn't choose medicine again, but also if we're not attracting our best and brightest in medicine, we're not going to continue to evolve and grow. And tell me, what if you had a young person in college or even high school interested in medicine, what would you tell them, and what would you encourage them to think about it when they decide if they want to go to medicine or not?
Yeah. Well, it's a great question, and I think that we all during these last couple of years have probably worried about our specialties, our field, our practice. But I still firmly believe. I had a group of students that we work with here locally in San Leandro, and we have a great faculty program. We have a lot of faculty directors, and they, when you talked about joy in practice, they get such great joy in being able to educate the future generation of physicians. And so what I tell them is that you are the hope. You are the hope for where healthcare can be in the next 30, 60 years. And what you will do now what you will do in your future practice will actually set the foundation for the next 100 years, because we are at this just incredible tipping point on how healthcare is changing, and it will change very rapidly. So I very much encourage them to pursue practice, but I also encourage them to tell us what we should be doing that we're not. I think that the fresh learner has so many questions that we're in a different phase compared to when I trained. I sort of was. We often talked about how your attending would ask you questions, and it was a nerve-wracking experience, versus now it's a much more engaging experience. It becomes more bidirectional because of how our learners challenge us. So I would very much encourage them, and I can tell you that when I speak to our learners, I know that we're going to be in great hands. I mean that. And my daughter, I'll just share, she's 13, and she shared with me recently that she wants to shadow our pediatricians. She's interested in becoming a pediatrician, and that gives me great hope and excitement actually for the future.
That's phenomenal. Yeah, that's one of the things I love best about teaching medical students and residents is they constantly are asking you questions. You're like, oh, geez, I better look this up. Or, they sort of make you a Zen master on kind of your field, because they're constantly encouraging you to learn more and to grow more too. And that's what I love about being an educator in medical education as well too, personally. So this is fantastic. We could go on all day, but we try to keep these high yield as well too. So last and perhaps the most important question, what makes you most proud to be a Permanente physician?
Oh, what a great question to end on.
It's a softball. It's a softball question.
Yeah, no. Well, thank you for that. I'll try to hit it out of the park. So just a little background. So I had the privilege when I went to college in Northern California to work for the Permanente Medical Group. I spent 2 years as an analyst, and I worked in the access service department. Yeah, in 1950 Franklin and Oakland. And so at the time, I think the medical group and many medical groups were struggling to really kind of lift and figure out who they were going to be. And I was part of kind of seeing this peripherally, this resurgence of our group, heading into Kaiser Permanente for residency and now being in the medical group. And what continues to make me so proud is that our values have stayed consistent. We believe in integrated care. We believe in a model where not only what we do impacts individuals, but it impacts families and communities. And our incentives are aligned to do the right thing. Never felt the pressure to order a test because I needed to for any other reasons. I never felt the pressure to not do something because I was disincentivized. I was encouraged to practice evidence-based medicine. And so for me, that's what makes me most proud to be a Permanente physician, is because we're doing the right thing for our patients, and it really lifts our practice forward. And I see that model continuing. Despite the pressures we feel, it's that part of that value stream. All of us have to be consistent and working hard to maintain that, because I think that's what American healthcare needs.
So well said. And that's a fantastic note to end on. So thank you so much, Dr. Dhingra, for joining us today and sharing your expertise with us. And happy Doctor's Day tomorrow to you and everyone out there listening.
Thanks, Al. Happy Doctor's Day, everybody.